Hi, Yolanda.
Hi.
Thanks so much for joining me today.
Thank you.
Now, your chapter has more than 2,000 members?
Yes, we have about 2,300.
Tell me about them.
They consist of employees from the IT fields, health communication specialists, biologists, epidemiologists. We even have a couple of EIS officers. So it's a range of positions across the agency.
And how do they generally feel about the CDC? Why do they go to work there?
Many of them go for the public health mission. Some of them plan it from the time they're in college, undergraduate. They're already thinking about pursuing their master's in public health so that they could come over to the agency and, jump in on the mission.
August 8th, 2025.
Horrible time for us. Horrible.
Tell me about that day.
On that day, a shooter attacked the CDC campus. None of the employees were injured, but we did lose DeKalb County police officer David Rose, who attempted to stop the attacker. And since that time, many of the employees have been going through a really stressful period, especially since they've been basically forced to return to the campus where there are still bullet holes in windows, there's still a lot of damage within the buildings, and they're just being asked to swallow the fear and report back to the office. So it's been a really tough time.
It's this incredible tension between feeling like you're going to your job to help people be healthy and feeling under threat at the same time.
Yeah, because a lot of employees, they're not healthy at this time. They're just going through the motions, hoping they still have a job, hoping they can still continue that mission that they signed up for.
It's not as if the rest of the agency has been smooth sailing.
No, it has not been. It's been rough waters.
Yeah, tell me more.
Sometimes it feels like the ship lists to the side and there's no one there to right it. And then other days you think that the seas are just a little bit choppy, but we'll be okay. And then once again, you get that big wave and you list to the other side. So it's been a back and forth, and some of the employees feel like they've just basically been in an abusive relationship and they can't get out.
Wow, that's a vivid image. I mean, you have programs wiped out, funding cuts, then people fired, and then sometimes people come back and then they're fired again. Exactly. How do you try to support them at AFG?
We provide a lot of resources. When the attacks happened, one of the first things we did is we sought out experts who handle the aftermath of shootings, the people who are left behind that have to process that trauma. And we brought that trauma expert on board, and we held like a town hall, and then we also offered like private consultations with that mental health therapist. So we provided that, we provided information, we helped guide them through the process for people who would need like reasonable accommodations because mentally they just could not, even imagine going back to the campus. And that takes into consideration, we also had some disabled vets who were already diagnosed with PTSD, who were also being told that they needed to come back into what they now considered a war zone.
Yeah. How much of it was frustration that CDC could have done more to be supportive?
I think that there were a lot of opportunities. I don't think that all the opportunities that could have taken were. There were some attempts, but we still feel like it came on the heels of the union beginning to perform in place of the agency, and then the agency being shamed into doing something because it did not feel like there were a lot of people there who cared. I mean, we never heard from some of them. There was never any, we're sorry about what happened to you. We're taking every measure we can to ensure that this doesn't happen again. We're going to speak out against what may have caused this to happen. That never took place.
One of the difficult things for people on the outside is we rarely hear from people who are working inside. That means you and your role in the union is very important. What do you think people inside CDC would want an audience like this to know?
They would want everyone to know that they sacrificed. They sacrificed, I guess you could say, a more stable environment. Some of them sacrificed a larger paycheck. Many of them have sacrificed families, their own mental health, like I said, and all they want to do at the end of the day is to be able to do their job.
Wow. What comes next for you for the CDC?
For me, we will continue to move forward because, some people have said, well, why don't you guys just quiet down a little, put your heads down and see what the next few months bring.
Right, I'm guessing that's not what you're thinking.
We're unable to do that.
It's not a persuasive case.
We don't even know what that looks like. We have no idea. Yeah.
So tell me about that. What do you think should we be aware that you're working on? What is important for people to do to be supportive of the employees of the CDC right now?
What we will do is continue to hold the agency accountable. If that means throwing federal law in their face and, insisting that they follow what federal law says until that law does not exist anymore, that's what we're going to continue doing. If it means media outreach, if it means guiding employees through the process of appealing violations of their federal rights, we're just going to keep doing that. We're not going to go away because the agency says, oh, we no longer recognize you. We are an independent entity and we will continue operating that way.
Right. What can people do to be helpful to CDC right now?
Be a voice for us. When you hear things that don't sit right with you, that you know are not right, when you know that there are funding cuts to very important and crucial areas of the country, speak out about it. Say something, because a lot of times the agency figures, if we just keep quiet and we let the union run its mouth, it'll run its course. But when everybody starts speaking up and everybody starts saying something, that's when the change comes.
Yeah, CDC is an agency. Well, sure, let's get that in there. Let me just say that CDC is an agency that has supported all of our health for so long. This is a moment where we really need to support CDC and its employees.
Yes.
That's for sure. Well, thank you so much for coming up to Baltimore.
Thank you for having me.
And for talking to us about this. Please send the message to your employees that we're all here in support of them and the CDC.
Thank you. I appreciate it. Thanks, everybody.
And now, please turn your attention to the screens for a special message from the Governor of Maryland, Wes Moore.